Over 350,000 Americans go into cardiac arrest every single year, and 10%, if not less, actually survive those out-of-hospital cardiac arrests. So knowing CPR, just hands-only CPR, could double or actually even triple their chances of survival. We know that most of the time this doesn't happen on the football field. This doesn't happen in Walmart. This doesn't happen in your local grocery store or at a football game or a baseball game. This actually happens in the home. More than 70% of the out-of-hospital cardiac arrests happen in your home. It could be your husband, it could be your wife, grandma, grandpa, or any other family member. So we really strive the importance of knowing this skill. We see that less than half of the Americans who have interacted in a situation like this don't even know what to do or know what signs to see. When you actually have someone who's unconscious and unresponsive and not breathing, it's really important that you act. The American Heart Association says that one of the first things that we really need to do is recognize they're in cardiac arrest and really activate emergency response early. Call 911. Make sure you get help. Tell your neighbor to call 911. Tell your husband, your wife, your children to call 911. Tell someone to do that so we can make sure that help's on the way. The second chain that's really important to make sure that they're all linked together is early CPR with a big focus on chest compressions. And as layperson responders, people that are not fire department, not EMS, not law enforcement, not hospital, hands-only CPR works. You don't have to do mouth-to-mouth anymore. What we're looking for folks to do is just do hands-only CPR. So you can actually do CPR with just hands-only CPR. You don't have to have some kind of crazy certification. You don't have to go through some long class. These classes take an hour, if not less than that. The biggest thing is if you see somebody laying on the ground. So we have Bill here. Bill is going to be our patient for today. He's looking a little blue. That's normal though. So Bill is just passed out and we see that Bill's not breathing. So for at least 5 but no more than 10 seconds, what we're going to do is we're going to look to see if Bill has any signs of life and see if we see any kind of breathing. And this can be that he's normally breathing, we can hear breathing, we can feel breathing, we see his chest going up and down, we see his stomach moving, anything that says he's actually breathing. If we see no signs of breathing for at least 5 but no more than 10 seconds, what you need to do is make sure that someone calls 911 and start CPR very, very soon. And how we tell people to start CPR is make sure that Bill or whoever else is on the ground. Make sure there's no pillows underneath Bill. Make sure there's no blankets underneath him. Make sure he's on his back, laying face up. And what we want to do is find the center of his chest at his armpit line. Find the center of his chest. That's where we're actually going to put the heel of our hand, is at the center of his chest. Make sure that you remove any clothing, unbutton any shirt. We want to get to as close to skin as we can. If you're not able to do that, if they're wearing a big jacket or something else, that's okay. What you just need to do is just make sure that we get really good compressions. So using the heel of your hand, place it in the center of his chest or her chest. Put one hand on the other. You can interlock your fingers, or you don't have to. You can just put one hand on the other. And you're just going to push down at least 2 inches and come all the way up. Now it's really important that you make good depth and good recoil. Every time you push on the chest, blood goes throughout the body. And every time you actually let the chest come back up, blood comes back to the heart. So you actually doing CPR, you're actually acting as heart function, not really realizing it. So push down and up, hard and fast. We're looking for about 100 to 120 compressions a minute. So if you call 911, 911 can actually time you as you go through. And they'll tell you, keep doing compressions, keep doing compressions. But what we're looking for you to do is get as close as you can, one hand over the other, center of the chest, keep your shoulders over them so you're just pushing down. And chest come all the way back up. And you're looking for about 2 a second is what you're looking to do with compressions. At least 2 a second to actually greatly improve their out-of-hospital survival rate. Because again, less than 10% of these people will actually survive this event and become a number of over 350,000 people that have passed away. What you're going to do is just do CPR until help arrives. So just do compressions until help arrives. Hard and fast until you get tired or until you can't do it anymore, until somebody can take over for you, until 911 actually gets there, until police, fire, EMS, or some other kind of provider gets there to take over for you, and they'll actually start doing a little bit more with their equipment. They'll start doing things like more basic life support and more advanced life support. And don't be surprised if EMS stays on scene during the cardiac arrest. I think as everyone saw in that football game, EMS was there for a while. They were actually doing care on the scene. What studies have shown is that CPR in the back of the ambulance is ineffective. It's very ineffective. It actually doesn't really do much for the patient. So actually staying on scene, doing CPR and doing advanced life support is what actually brings people back. And we saw that what EMS and what other responders did that night actually saved his life. They didn't load and go and try to run to the hospital super quick. They actually stayed at that scene, stayed on that field, and cared for him, really in the view of millions of people on TV and millions of people in that stadium, just to make sure they could actually bring him back. So what you may see from EMS and the fire department and police is we may stay on scene actually working the cardiac arrest, or what we say working the code and doing CPR and doing basic life support and advanced life support until we actually transport. Because that CPR in the back of the ambulance doesn't work. And we've seen that from studies. The biggest thing, center of the chest, arms over the patient, push down and up hard and fast, 100 to 120 per minute, until 911 gets there, until help arrives.
Can you go ahead and do it?
Yeah. So after you've confirmed that he's not breathing, you're not seeing any signs of life, hard and fast is what you're looking to do. And you're going to keep doing it until responders get there.
You do it sideways, not in front?
So just
You're not straddling him.
No. Yeah, you want to do it from the side. You want to get as close as you can. Of course, we've got Bill here on a table just so everybody can see. But get as close to him as you can, because we're wanting to just use our weight to push down. And the biggest thing is the heel of your hand is what needs to go in the center of the chest. You're going to hear ribs crack. Usually what that is actually ribs separating from the sternum. Ribs are connected to the sternum via cartilage. So that's what you're going to hear a lot of times. Center of the chest is where you want to stay, so you push that sternum down and up, down and up. Don't go too low, don't go too high.
Wow, I don't want to crack the guy's ribs.
It's one big thing with that. It's a good question that you say. It's not going to happen every single time. The ribs are actually made to move. Your ribs move every time that you breathe. When you breathe in and breathe out, your ribs move. So it is a more normal motion. It's just a little bit more impact that we're actually doing when we do compressions. But you're actually not cracking the ribs. A lot of times it's just that cartilage that's breaking away. So this is something that's really important to try to save a life, to try to greatly improve that out-of-hospital cardiac arrest survival rate.